Previously on MDA.
St Albans needs a new director of emergency services, and we've been canvassing a few opinions regarding who we ought to approach.
Well, probably Kevin Grant, Northern, or Kath Dunn. Everyone likes
No, I mean, both their names have been mentioned, but they're not the name on the top of the list.
Caitlin.
Richard. Justin Harris, Richard Savage.
Justin.
Sorry to meet and run. Business.
It's fine.
Our relationship now is purely business.
I wasn't suggesting a dinner for two, Caitlin. I mean,
No, you thought if I hadn't already arranged a date with Justin, it might be a nice little tactic to keep me away from him.
I would never do that.
It's gonna be weird going into your flat without you, Wend.
I want to stay at Mum and Dad's and tell them that I'm going nowheres.
Okay.
I'll call you about picking up my things.
Tough night, huh?
3 patients have died on me in the last 4 months. One on the operating table, one in post-op, and now tonight the young girl. Everyone did their best.
Kind of takes the gloss off the coal face, doesn't it?
You have these nights?
Yeah, doesn't get any easier.
Yeah.
Mr. Lloyd, the parents are here and there's no room available.
So what's new? David, Jess, we did all we could, and I'm terribly sorry that she's...
Jamie? What you doing here?
Just on my way.
Is Wendy picking you up?
No.
You need a lift?
No, I'm fine, thanks. I'll see you later.
Can we sit down?
Hi, Jamie. Jamie. Morning.
Morning.
I wondered where you were. It was a bit X-Files out here. You all right?
Yeah, I'm fine.
You're in early. When do you have an early start?
Yeah.
Morning, Layla.
Morning.
Morning, Jamison.
Morning. You so don't need that good.
The face work without this goop, I'd need some sleep.
Phone your boss and tell him you'd rather come back to bed with me than work this morning.
I don't think he'd sanction that.
Not the things I've got in mind, he wouldn't.
I have to go. I have to be in court.
Fine. Choose the corporate life rather than a world of pink passion.
What about lunch?
No, I can't make it. Sorry.
Work.
Sort of. Right. Business mode then. Bye.
Bye.
Wait up. Wait.
I've got to get to work.
Jeez.
Caitlin!
Hi there.
Hi.
Ready for court?
Of course.
Sure your mind's not on something taller, darker, more bubbly?
My mind belongs to my client as of now.
Good, because you've got some case to make on his behalf. His claim is so statute barred.
Well, it was your member who was so negligent.
And it was your client who's taken 20 years to act on that. So who is he?
Colin Kiley, and then 20 years ago, MDA member, Dr. Frank.
Caitlin, you know what I mean. Is he a lawyer? Doctor?
Well, your Dr. DePazzo stuffed up big time, and I think my client has a legitimate case.
Which is barred by the statute of limitations by full 14 years. So is he a journalist?
Poor bloke's about to lose bladder and bowel control. I think he has a right to make a claim.
It'd make the statute meaningless. It's 6 years. He's waited 20.
Well, the statute's not printed on the back of milk cartons, Amanda. Extensions are reasonable.
Right, and if the judge allowed one this big, we'd have 10,000 other ancient claimants coming forward. Oh, my appendectomy scar from 30 years ago is unsightly, Your Honour. That's all right, Mr. Plaintiff. Kiley and DePazzo established that waiving the statute of limitations, cool bananas.
Say cool bananas in front of Judge Perry, I dare you.
I will if you use your milk carton argument. Hey, has he got a friend? You're not doctor, not lawyer guy?
The thing is, we're talking gradual damage to the spinal cord. There was nothing to notice within the statutory limitation period.
Progress of the condition is irrelevant, Caitlin. So, is it serious with this guy?
We're moving in together.
What, seriously?
No. We've only been going out about a week.
So it's just a fling?
Maybe a bit more.
Great. So it's not just sex.
Would you like a microphone? No, Justin, it's more than that.
So, Justin?
Yeah. It's like nothing else I've ever experienced.
And?
Kiley and DePazzo.
And my Mr. Kiley's condition took more than 10 years to manifest, so what's the point of a 6-year limitation period?
So you're doing extra shift at the moment?
Yeah, we're so understaffed, it's a joke. Hap? Can I talk to you for a sec? Oswald Brown made me an offer the other day. Director of Emergency at St Albans.
A full-time job?
Yeah.
Well, you wouldn't consider it.
Just been, you know, I've been thinking about it, that's all.
What are you saying, you'd leave?
No, it just started me thinking, you know, maybe I could do more, I could help more. I don't know.
Rather than what you do here, which is virtually unnecessary.
I don't know, maybe just since the accident, What do you think?
As a director, you would hardly see a patient. You'd be up to your neck in a sea of hospital bureaucracy, and the one thing you most definitely are not, madam, is a bureaucrat. And you do good work here. Remember that. And you'd be surrounded by doctors, nary a lawyer in sight.
Gosh, imagine that.
Okay, just answer me this. What is the point of having a limit on claims if Justice Perry is going to ignore it by 14 years?
I take it he granted Caitlin an extension on her statute-barred claim.
He banged on about the court's responsibility to uphold the law and then did a backflip and okayed a claim which has been cold since I was in first year uni.
So the DePazzo writ is active, as distinct from our deceased Dr. DePazzo. This is turning out to be a very interesting morning.
Hap, don't you speak? You know, there is some justice in upholding the claim because Frank DePazzo was actually negligent. He overlapped the radiation fields and the patient did get twice the usual dose.
Yes, but the hearing today was about timing.
Yes, but the timing doesn't alter the fact that the patient suffered and is suffering.
And he should have done something about it within the time limit. Perry should have upheld it.
Well, I'm sure Colin Kiley, who's going to end up in a wheelchair at 50, is very glad that he didn't.
And get a copy of me once you've done that. That'd be great, thank you. How'd you go?
The Kiley case will run.
Perry granted your extension?
Said I'd made a case that the statute shouldn't be used punitively.
He's refused the last 3 extensions I've argued before. Maybe he likes the colour of your hair.
Maybe I made my case well.
Obviously you did.
Well, the client's not going to be able to work for life, so we stand to get a very big settlement with this one.
If you make your case well.
You lacking faith, Richard?
No, not at all. Just thought you'd give me some pointers for arguing for statute extensions, that's all. Take it you had a nice weekend.
Yes.
Yes?
Thank you.
Must have been exciting for your friend watching you swat up on statute law the whole time.
I'm a very quick reader.
Convenient for both of you.
Very. I've got things to go on with.
Okay.
Thank you.
You okay?
Yeah.
Hi, can I help you?
Are you okay?
Take a seat, he'll be right with you. Jamie, Dr. Warner's here.
Dr. Warner. Oh, right. Okay. Dr. Warner, hi. Jamie Lawless. How do you do? Come on through. Happy. If you just take a seat in here, I'll be with you in just 1 second. Happy, this is the craniostenosis.
What's a craniostenosis, for Christ's sake?
When a baby is born with a fused cranium, the skull plates should be unfused to allow for brain growth.
What, the soft, pulsy thing on top of the head, isn't it?
The fontanelle. Sorry, didn't I tell you?
No, certainly did not. So, Matthew's mental age has been assessed at about 3, and at age 18 has few self-help skills, incontinence and limited speech.
The thing is that I suspected that Matthew had craniostenosis at birth. By the time I saw him for the 6-week check, there was no doubt that his skull plates had fused.
And as we all know, the fontanelle needs to be unfused.
That's right. I said then that there'd have to be an operation or he'd get increasing pressure on the brain.
And his parents accepted that the operation was inevitable?
Oh, well, they're upset as you'd expect, but yes.
And you explained that the surgery wouldn't actually take place until Matthew was the appropriate age?
Yes, I said that when he was 2, I'd refer them to a paediatric surgeon. But the Eagletons didn't bring Matthew to see me at all from when he was 14 months until he was nearly 3. I thought they must have moved. I was actually horrified when I realised that he hadn't had the operation.
And you got onto the specialist?
The surgery happened within days. It was completely successful.
Except that Matthew was clearly disabled. They say that you did not tell them there was an urgency for the operation.
I made it completely clear. I spelled it out for them.
Your notes are a bit ambiguous.
Whether my notes back me up or not, this is irrelevant. None of this caused Matthew's intellectual disability. He was like it from birth.
Are you saying that he was born disabled?
You're absolutely right, Mr. Henderson. I felt it from the word go.
These would be the developmental immaturities that you cite.
Yeah. See, at 3 months, floppy, fails to hold head erect. At 6 months, still unable to control upper half of torso, little eye contact. The first smile, not till 8 months. At 14 months, still no babbling. It's a telling signs.
Telling, but not conclusive.
Matthew's disability was pre-existing. I know it.
Well, it's a pity that your notes aren't more thorough to make it a heck of a lot easier to defend you.
Well, all right. Well, maybe they should be. But I'm a solo GP in a bloody busy practice, and I do the best I can, OK?
So you were having trouble eating and swallowing?
Pharyngeal pouch. Pocket in the throat.
And the food got caught. Has the surgery corrected it? But in doing so, the surgeon has perforated your esophagus and you got an infection which has caused this damage to your voice.
Right vocal cord. I'm a teacher. Primary school, but can't be heard. Can't sing. People stare. Have to keep repeating myself.
The surgeon, did he ever warn you of the risk?
Perforation, but nothing.
Nothing about the risk of damage to your voice?
Nothing.
And if he had warned you, you wouldn't have had the surgery?
Is that what I have to say?
Mrs. Rosenbaum, what would you have done if Dr. Gosper had informed you of the risk to your voice? Would you still have had the operation?
It wasn't going to get better by itself. I'd have choked.
Okay. This is what we call a failure to warn. Success with these cases relies on the fact that if the patient, yourself, had been warned about the risk they faced, you wouldn't have gone ahead with the operation, but it doesn't seem to be the situation here.
I'd have thought about it.
But you would still have gone ahead with the surgery even if you'd known the risk to your voice?
Eventually, yes.
I can see you've suffered, but given that you still would have had the operation, it makes it very hard for us to argue in your favour. I don't think we can get this one to work for you. I'm very sorry.
So what did the Eagletons say to your suspicions about Matthew?
The shellers came down every time I mentioned it. They wouldn't even look at the idea. I guess that's why they stopped bringing Matthew to see me for those 22 months. They just wanted to believe that everything would be all right. And who can blame them? And the ostrich approach doesn't stop the inevitable. It just stops you seeing it coming to knock you flat.
Okay, thanks, Dr. Warner. We'll request Matthew's other medical records from the Eagleton solicitor, and we will let you know how we go in mediation.
I can see my way out, thank you.
Okay, so who is the Eagletons? Solicitor. Oh, Jesus. Peter Munro, the unctuous gerbil rides again. You look rat shit.
Is the trial tomorrow?
Day after.
How can you drive your car straight into someone and still plead not guilty? Is it the margarine?
Nah, just not hungry.
Will Wendy be in court with you?
No, she won't. She has run away to join the circus. Médecins Sans Frontières.
Oh, Jamie. I wish you'd said something.
Nah. What's to say? She's gone and I'm here.
Wendy's left.
Oh, God. Poor Jamie.
Ella, is it true? What Happy said?
It just slipped out.
You always do this. Bill Henderson, human foghorn. And still you managed to get it wrong.
Well, what part did I get wrong? What, the part about you leaving MDA?
I haven't made up my mind yet.
Okay, look, let's look at it. Points in favour of staying at MDA. Varied and interesting work, dynamic work environment, important and groundbreaking cases, reasonable people, and nice pastries. Okay, now, points in favour of going to St Albans. Long hours, surly doctors, immense pressure. No, I can see why you're attracted to it.
Well, they might respect privacy and confidences.
Okay then, off you go to your new exciting life with all the new exciting challenges, and do not think for 1 minute that your knowledge and experience is in any way indispensable to our members, not to mention our colleagues. So please don't worry about it, because we will be just fine.
Oh, that's a lot off my mind.
Jamison, how progresseth Dr. Warner?
It's not the only thing I've had to do. Happy?
Well, they won't keep you as warm as I've been, but I thought they'd match your eyes or your hair or something.
They're beautiful. Thank you. I almost called you earlier to thank you.
Almost.
Yeah. It was lunchtime, and you said you had a business appointment or something?
Sort of.
A secret?
Yeah. At lunchtime, I turn into an axe-wielding Neanderthal. No, there's someone I like to see regularly.
Who? Mad wife you keep locked in the attic?
Yeah, sort of.
You're being very mysterious.
Well, they say that's part of my charm.
Let me ask you, do we have any actual evidence that Matthew Eagleton was disabled from birth, or am I to base my evidence on Dr. Warner's masterly hunch?
Well, has there been a DNA test? Is there any genetic basis for the disability?
Well, this is the stuff that Peter Monroe sent over. Somewhere in there is a DNA test that came out clear.
Yeah, I don't like that, Peter Monroe.
You don't like anyone.
I reserve particular antipathy for that mealy-mouthed hamster. So, if the boy's disability is not genetic, is it possible that the delay in surgery didn't cause it?
It's absolutely possible. There are plenty of causes other than genetic ones. There's hypoxia at birth.
Rough use of forceps or venous suction during delivery.
Toxins crossing the placenta during pregnancy.
Accident during pregnancy, excessive drinking during pregnancy.
And just because we don't know what caused it doesn't mean it was a Dr. Warner.
Yeah, and according to him, the Eagletons should have been more proactive about organising surgery at the proper time.
Therefore, he shouldn't be made a whooping boy to their guilt or grief.
OK, well, I will go into mediation, all guns blazing. Now, Jamison, could you make sure that you peruse those before that point in time?
Man, I've got to be at the hospital, actually, for a shift.
But I thought you were enjoying the cut and thrust of medical defence, Ella. Are you secretly pining for the chilly fjords of the hospital boardroom?
Have. See ya.
Are you OK with your
Bye.
court appearance coming up?
Yeah, I'm fine.
If you need any pointers from an old solicitor, don't hesitate.
Actually, yeah, Hap.
Happy, how many more dead members like Dr. DiPazzo do we have on our books?
Well, we have 14,000 members currently, and goodness knows how many others who've shuffled off this mortal coil. They are, in fact, my favourite sort of member, the ones you don't have to talk to. But Dr. DiPazzo will certainly not be our last zombie that we're obliged to pay out for, I can assure you.
Maybe we won't have to. I want to do a check to see if his estate's been fully administered.
Hi, can I help you?
Out of interest only, of course.
Take a seat, he'll be right with you.
Jamison, you seem not to be your usual self.
Happy. I've got a Dr. Smith here. She wants to talk to someone.
Right.
Actually, Nancy called before. She wanted to remind you that tonight's the last night of the school performance of Twelfth Night.
Oh.
She also said if you missed it, you could expect consequences.
Yeah.
She actually sounded like she meant it.
I can take this one if you like, Happy.
Oh, thanks. Thank you, Amanda. Yeah, my eldest daughter is playing the lead.
Oh, you'll have to go.
I doubt the bard in his wildest dreams envisaged a surly adolescent with green hair and an eyebrow ring.
Well, if you miss it, I'm not sticking up for you.
I'm Amanda Mackay.
Call me Sarah.
How can I help you?
I think I might have made a mistake.
Perhaps you'd just like to step this way.
So, do your secret assignations mean that we can never do lunch?
Only while I'm in therapy.
You're seeing a psychiatrist?
Yeah, twice a week. She's pretty messed up. She needs someone to talk to. Oh, no, you're thinking
you're seeing a weirdo.
No. A lot of people I know should be seeing a psych, but they're not brave enough to admit it.
No, I don't know about being brave. It's just that I had a lot of shit going on in my life and my head. And I thought if talking to someone is the best therapy, then why not see someone?
I've been a practicing psychiatrist for the past 2 years. And a couple of months ago, this particular patient was referred to me. A man.
And what, he's come on to you?
No, nothing like that. No, the problem is, the police think he's killed someone. A couple of weeks ago, they asked if they could secretly record our sessions.
Ah, okay. Well, I'm glad you've come to us. Our strong advice would be not to agree to that under any circumstances.
Yeah. The more I thought about it, the more I thought, that's what I should have done.
So you've already said yes?
Yes.
And the bugs are in? They've already taken a session?
Yeah. I just thought if I said no, and then 6 months later he'd kill someone else, how would I feel then?
I know, I understand that feeling. It's just that unfortunately I have to warn you that if he's innocent and he finds out that you've been recording your sessions and then he complains to the medical board, that's when things could bounce back on you.
Shit.
Which is why if you told us before, we would have told you not to do it.
What can I do?
Well, you'll have to get the surveillance equipment removed and then we'll have to see your case notes.
Of course.
I've only been seeing her a few months, but then... the last few weeks, I don't know if I'm imagining it, but she seems a bit weird herself.
Weird how?
I don't know. Different. Nervous.
Maybe she's coming on to you.
Yeah, because women find me so attractive. Haven't you noticed? No, she just wants to talk about my work. What I do, how I run my business. I keep waiting for her to ask when I stop wetting my bed, but...
You'd be more comfortable with that, would you?
Well, isn't that what psychiatrists are supposed to ask?
Make a complaint.
Oh, yeah.
If you're unhappy, try and get a referral to a new psychiatrist.
You came along just in time. Let's eat. Confession makes me hungry. It's the lapsed Catholic in me.
Thanks, David. Hey, do you mind? I heard on the grapevine you're being touted for higher duties. Well, it's no secret, Oswald wants you as the new director of emergency. Everybody thinks you'd be terrific at the job.
Maybe.
It's a big change. It's a big job.
Not scared of the job, I
You don't
just
want to
can't imagine.
desert MDA.
Something like that.
Your work is important there too, Ella. And it's not easy, as I found out.
Happy was delighted the way you rubbed Richard Savage up the wrong way in mediation.
Really?
Actually, not being intimidated by lawyers is exactly the way a medical case manager needs to be.
Well, it's exactly why you're so good at it.
Wasn't talking about me.
Mrs. Sophie Rosenbaum, paralysed vocal cord.
Yeah. Hasn't got a case, I'm afraid.
Clear harm, clear adverse outcome.
Yes, but it's not a failure to warn.
The doctor who operated on Mrs. Rosenbaum was a young guy, right?
Bryce Gosper, 34, had been working as an ear, nose and throat specialist about a year at the time of Mrs. Rosenbaum's surgery.
The operation carry recognised risks?
Well, perforating the esophagus during the removal of the pharyngeal pouch happens.
Happens 1 in 20 times.
The average is 1 in 30.
You've done your research.
The subsequent infection leading to the damage of her vocal cord could be argued that it was just bad luck that she had that particular bug in her throat at the time of perforation.
Caitlin, bad luck. There is no such thing as bad luck in med-neg law. Let's imagine having been informed of the possible risk of damage to her voice. Miss Rosenbaum decides to put off the surgery for a while, check out the surgeon's experience, success rate. Now, she has been denied that chance. Does that give us a case?
No.
Why not?
Because even if Dr. Gosper had been as careful as possible, this still might have happened. The risk is never reduced to 0.
But it varies surgeon to surgeon.
It comes in at 1 in 30 cases, like I said.
And I heard you, but you are confusing across the board.
I'm not
rates.
confusing anything,
Caitlin,
Richard.
I'm talking individual rates, okay? You know, one surgeon will perforate 1 in 40, another 1 in 20. So 1 in 30 is an across the profession average.
So you're saying there could have been a different outcome if Mrs. Rosenbaum had been given a chance to find a different ENT man?
Mm-hmm. Yeah. I mean, you know, someone with a little bit more experience who had a lower rate of perforating the esophagus than Dr. Gosper.
Yeah. You think it'll run?
Yes.
Okay.
You now have yourself a case. That's assuming you have as much time for work as for play.
How's it play?
Well, Sarah remembered all her lines and was audible.
I hope you clapped.
Till my hands were bloodied stumps. Morning, Jamison.
Ella. Dr. DiPazzo, you don't happen to remember when he died?
Early 2000, Feb, I think.
Walking MDA archive.
He'd been a member for 22 years.
Thanks.
What was his star sign? So useless on the important stuff.
Guilty as charged.
Morning, Mark.
Morning, everyone. God, it's a beautiful day out there.
A word in your shell-like, Mark.
So what do we do? Offer her more money?
No, I don't think it's about money.
No. And even if we were to offer her more money, I doubt whether we could match the carrot that Oswald bloody Brown's dangling in front of her. I mean, Director of Emergency, why would you want to take that poison chalice?
She wants to create a brave new world of litigation-free medicine.
Yes, well, knowing Ella, I suppose she could. You think we can keep her, Bill?
Yep, I do. My approach has been to make it clear that there's scope for good and important work right here, doctoring the system.
I hope you didn't put it like that.
Well, she needs to feel needed, and I think I've managed to convince her that this is where she belongs.
Yeah.
My ears are burning.
Ella, I must say your timing's appalling. What have they offered you?
Oh, shut up. It's not about the money.
Look, it's just with Caitlin having just gone. It's going to be incredibly disruptive.
You'd be leaving us with a pit full of lawyers.
How the hell am I going to find someone to replace you, to replace your experience?
New blood? Chaos? Disorder?
As it happens, there may be somebody who could be very good.
Oh, I see. First you leave and then you appoint your successor without even telling us. There is such a thing as protocol, Ella. Who have you got in mind?
Simon Lloyd.
Really? He interested?
Well, he could be. You remember him, Hap? He does.
He's a bit of a loose cannon, shooting his mouth off.
He'd be good for this place. I think he would be.
Yeah, could be. Well, he trained under old Daniels. He's pretty smart.
You're moving on, aren't you?
Look, I just think that with the way the hospital system is going, I could maybe put some new reforms in place. I don't know, make sure staffing levels are conducive to good medicine, that sort of thing.
That all there is?
Hap. When Tony died, something in me stopped, and I can't start it up. You need people in this place who are wholeheartedly here. You need, you know, Amanda's got that in spades, and so, I believe, would someone like Simon Lloyd.
If you must, you must.
Thanks for coming in again, Mrs. Rosenbaum.
That's all right.
This is Richard Savage.
Mrs. Rosenbaum, I will be assisting Caitlin if she needs it.
We've been giving your case a lot of thought, and we think we may have found a line of argument that could work for you.
You're gonna take it on? Think a judge would see it my way?
Caitlin's come up with a very interesting argument to support your case.
I'm hoping we won't have to go to court. The other side, Dr. Gosper's defence organisation, hopefully they'll settle this.
Oh, thank you, Miss King. Mr. Savage, thank you.
I can't pretend this is an easy or straightforward case. We may not win at mediation.
I'm sure you can do it.
I'll take a look at these and copy whatever I think's relevant.
And the police?
I think that's your call.
Of course. Thank you.
Thanks, Dr. Smith.
Sorry, I'm a bit early.
Justin, come in. I'll be right with you.
That him? Thanks.
Are you sure that it was him?
Absolutely positive. Justin Harris was the guy I saw with Caitlin. She was kissing him. What do you think I should do?
What do you mean, do?
Oh, I'm thinking maybe I should tell her.
You should tell a plaintiff's lawyer that the young man she's seeing is the subject of a covert police investigation in which one of our members has a major involvement, and in so doing jeopardise not only the investigation but also the safety of our member. I don't think so. I don't think you should tell Caitlin. I don't think you can as a lawyer.
Yeah, I know that, but I mean as a friend. What would you do? The guy she's seeing is suspected of murder.
Caitlin's always been attracted to the bad boys of this planet, but she manages to look out for herself, friends and no friends.
Okay. I just think I'd want to know.
If you guess it's your boss, I'll be very upset.
What are you doing here?
Just popped in. Not interrupting at all.
Is that a rhetorical question?
I've just been to see Dr. Smith about getting a referral to see another psychiatrist. She gave me the runaround. Just broke into psychobabble.
So you asked her?
Based on my lawyer's advice. And in return...
I deserve these.
Oh, you do. Helped me in ways no psychiatrist could. I'm done with anger, sorrow, and denial. Now I'm into lust.
I didn't know lust was one of the 12 stages.
Yeah. Followed by a slavish devotion to back rubs, massage. You finished?
More or less.
Is that yours?
Yeah. But we can't.
Jamie.
No, it's fine, really. Can you not?
I'll sort it out.
Simon, if you got a minute.
Hey, yeah, sure.
I thought I should mention that I dropped your name rather heavily for a position over at MDA.
Really?
I suggested to Hap and Mike Matthews that you'd make a terrific case manager.
What did they say?
They thought it was a terrific idea. How would you feel about doing something like that?
Eva's coming back from Germany soon, and I'm sure she'd like it if I was working something like regular hours.
Sure she would.
But, well, she would. But is there something about this job you're not telling me?
No. Except that it's a good one, a bit hard. And that they need someone in there to remind Hap that MDA was started by doctors 100 years ago, not lawyers.
Do you know what really happened? I do know. It keeps coming back to me over and over. Oh. Tony saved you. And I saved myself.
Jamie, it was a fraction of seconds. You couldn't have done anything.
I saw it, Ella. And it's the story of my life. True to bloody form. He behaves honourably, and I fall at the first fucking hurdle.
Jamie, that isn't true.
It's probably why Wendy left me. I don't face up to things.
No, that's not the reason Wendy left you. It had nothing to do with that. And anyway, you saved that girl. You helped her. You gave her back her life.
Ella, the thought I've got to say who I am in court, I don't want you to know. And none of it's going to bring Tony back. Did you know that's how it was? That he saved you?
I think I sort of guessed.
I don't know how you've been able to be near me.
Jamie, please, it isn't about apportioning blame. You just have to keep going. You have to just live with the fact that sometimes bad things do happen to very, very good people. But I can tell you one thing that did happen that I'm grateful for. I didn't lose two friends.
just had someone in wanting to sue their GP for not returning their Christmas card.
Oh, well, med-neg work gets more exciting by the minute. I've just sent the writ for service to Mrs. Rosenbaum's surgeon.
Good. Roses this time? So what does he do?
He's a florist.
Come on, seriously, I'm interested. Where is this guy from?
I don't know.
So what, does his family live here?
I don't know. And I don't know who he voted for in the last election either.
But he buys you flowers, and that's good enough.
Yes, it is.
Good.
James Stewart Lawless.
Stuart.
How'd it go?
It was a bit hard.
Jamie?
He went well. He did well. So did you hear?
Yeah, good news.
And how are you feeling?
Me? Couldn't be better.
That's good. In that case, I can ask if refusing to indemnify DePazzo is a delaying tactic to screw down a lower settlement figure, or we're really going to compensate Colin and Kylie.
Well, there's no real point in worrying about it, Ella, because you won't actually be here.
Right.
Wait a minute. What are you doing?
It's my move.
No, it's not.
Hap.
No, it's not your... You had the last move. It's not your move.
Hap, you moved your queen.
No, the Queen has been there all day.
Happy.
Just put it back, please. It is not your move.
Listen, I'm not going to Iceland. We can still talk.
And what are we going to talk about?
We're going to talk about life and chess and us, you know?
Well, what's not done today can wait till tomorrow. Good night, Ella. Bill?
I might tag along, Mark. I'll just stretch the legs, get a breath of fresh air.
Bye. Good night.
So how many more time bombs like this DePazzo thing have we got ticking away in the cupboard, Bill?
Ready to fill us with shock and awe.
Exactly.
Well,
You're saying that we haven't got enough reserves?
We can never really know.
It's time we got tough, I think. And with Ella bowing out, maybe now's our opportunity.
Well, Simon Lloyd's no shrinking violet, I can assure you.
Wonderful opportunity for Ella.
Yep, definitely.
I mean, change can be a good thing.
Oh, yeah. No, it's all good. It's all positives all round.
See you tomorrow.
Yeah.
Jesus, what do you think you're doing, you fucking idiot? Look where you're going. Piss off.
Up yours, arsehole.
Go on. Fucking dickhead.
Hello? Hello?
Pizza man.
Oh,
Sorry.
God. Yes.
Hope pepperoni's not too spicy for you.
Spicy's good.
I was hoping you'd say that.
Alison Cathcart will do time, won't she? 10, 15 years, who knows? Her kids have lost their father and their mother now. It's all pretty fucked, really.
Jamie. Alison Cathcart did what she did, and Tony did what he did, and you did what you did. And the world's not the same place for any of us anymore. Okay?
Yeah.
Amy, see if the Connors can come in tomorrow first thing. It's quite important.
Simon.
Hello, I got a call from Mark Matthews this morning.
And?
And I told him I'd take the job.